everyone. We are group 4 and we'll be focusing on diabetes in the low income and the 65 and older population. So the health issue that we'll be discussing is diabetes. Diabetes is a chronic health condition caused when an individual's blood sugar level is too high due to their body not producing enough insulin to help transport the glucose into the cell. Over time, those with diabetes become more susceptible to detrimental health issues such as heart disease, vision loss, and kidney disease. There is currently no cure for diabetes. However, there are many ways to decrease the risk of type 2 diabetes, such as being active, eating healthy, and/or losing weight. Currently, an estimated 60 million individuals 65 years and older are either diagnosed or not yet diagnosed with diabetes, and approximately one-half of the older population are pre-diabetic. When looking at income status, studies have found that low-income adults have the highest prevalence of diabetes in comparison to other income statuses, and have found that individuals with lower socioeconomic status tend to have poor glycemic control.
The impact of diabetes on the low-income elderly population is extremely significant. Aging results in effects on increasing insulin resistance, which leads to diabetes. Diabetes can lead to an increased risk for a heart attack, stroke, and/or kidney disease. And because nutrition plays a significant role in health, they are a group of individuals who are at an increased risk. Due to old age and possibly economic challenges, the mobility and financial situation limits their access to grocery stores and therefore influence their eating behavior and patterns. They would have reduced access to healthier food options and tend to eat foods that are easy to prepare. Diabetes can cause individuals to feel fatigued, more hungry and thirsty, lose weight without trying, urinating more often, have blurred vision, skin infections, slow healing from cuts and bruises, and nerve damages. And the elderly have a double rate of visiting the ER for hypoglycemia than the other populations. People assume that those symptoms are just due to old age, but we need to dive deeper into those problems. So those who are 65 years and older and who are low income have an increased risk of developing diabetes and other complications, and this needs to be addressed.
Policies and programs includes the Department of Agriculture enhancing the Special Supplemental Nutrition Assistance Program by increasing benefits, providing incentives for purchase of fruits and vegetables, and eliminating sugar-sweetened beverages. We also have the Affordable Care Act, which until today is still providing affordable healthcare access to many low-income families. In current policies and programs, we have the NCCC, which is recommending that the food and drug industry implement a mandatory system of front-of-package icons, which will allow the consumers to be informed of the health risk of foods and beverages. We also have the financial incentives for the state medical programs that cover the National Diabetes Prevention Program as a benefit. And for some interventions, we have the ongoing medical care behavior change, which includes diabetes self-management, diabetes self-management support, physical activity, nutritional therapy, psychological care, the smoking cessation, and medication management.
The nutritional issue that is being addressed is diabetes among patients who are in low-income families or are over the age of 65 years. The nutritional issue surrounds how poor nutrition in diabetic patients can lead to progression of health problems that are linked to the high glucose levels stored in their bodies. Therefore, patients need to understand that by changing their diet, they can help reduce the risk of obtaining diabetic eye damage, liver damage, and nerve damage.
In order to impact low-income populations and individuals 65 years and older at risk for diabetes, we would provide information and educate families on ways to eat healthy on a budget by buying whole foods from groceries and cooking at home. A healthy diabetes diet looks pretty much like a healthy diet for anyone, but it is specifically important for individuals with diabetes to get enough non-starchy vegetables and healthy protein while limiting the amount of higher carb foods that have the highest impact on blood sugar. We would encourage diets in this population to be high in whole grains, fruits, legumes, nuts, moderate in alcohol consumption, and lower in processed meats and sugared sweetened beverages that can be adapted to personal and cultural food preferences and calorie needs for diabetes prevention and management. Here are some nutrients that people with diabetes need to pay special attention to and make sure that they are getting in their diet regularly. vitamin B12, which is vital for the health of red blood cells, thiamine B1, and vitamin C, since individuals with type 1 or type 2 diabetes have a higher risk of thiamine and vitamin C deficiency. Magnesium and vitamin E, which fights toxins and maintains blood sugar levels.